Part 21. The reinforcing and reduction methods of acupuncture. The reinforcing and reduction needling methods are divided into the classical school and the modern school. Generally speaking, those of the classical school are based on the theory of Jingluo, such as setting the mountain on fire, penetrating heaven's coolness, yin within yang, yang within yin, and so on. These methods are very effective in reinforcing the deficient while dispersing the excessive. The various reinforcing and reduction methods of the old school are simplified into two basic methods, namely the gentle and the heavy needling methods. It is believed that the gentle needling method can cause excitement, while the heavy needling method can lead to inhibition. The modern methods are based on the nervous reflex theory. In spite of the difference in the theoretical foundation from that of the classical school, in practice, the modern methods are very effective. The two schools are quite similar in terms of needling location, techniques, and therapeutic purpose. Now let's take a brief comparison of the two schools. The theoretical basis of the classical method is to regulate qi and blood through the Jingluo, whereas the modern school is based on the nerve reflex. In the classical method, the concept of pathogenesis is based on the body's ability to resist disease versus that of the pathogens to induce disease. The modern school views disease as caused by weakened physiological functions as well as hyperactive pathological changes. One can see that the basic concept of both these schools are quite similar. The classical therapeutic purpose aims at reinforcing the deficiency and reducing the excess. The modern one aims at improving the weakened physiological function and reducing the hyperactivity of the pathogens. The point locations are the same in both classical and modern methods, but the needling techniques are different from each other. The classical school employs the methods of reinforcing the deficient and reducing the excessive. The modern school employs the gentle needling method to excite the body and the heavy needling method to cause inhibition. Cheng Dan-an says in 中国传旧学 that reinforcing the deficient means exciting the tissue, which is in a state of hypofunction, and reducing the excessive implies inhibiting the tissue, which is in a state of hyperaction. He also writes that the gentle needling method functions to excite the tissue, and the heavily needling method causes inhibition. Nevertheless, differences exist between the classical and modern needling techniques. Classical methods are too complex and cannot be adopted completely. Yet, the simplicity of the modern method affects obtaining the optimum results. To solve this problem, Professor Yang Changsun of Nanjing Traditional Chinese Medical University has expounded numerous simple methods from the classical school as a result of many years of study and analysis through scientific research, teaching, and clinical experience. He has set a standard of quality in order to distinguish between gentle and heavily needling methods. Basic reinforcing and reduction methods. Slow and rapid insertion and withdrawal. With this method, reinforcing and reduction effects are achieved by varying the speed of insertion and withdrawal. Reinforcement is achieved through slow insertion and rapid withdrawal. After penetrating the skin, thrust the needle to the required depth through all three levels, with needling manipulation at each level. Then, lift the needle to just below the skin before taking it out. Reducing is achieved through the opposite method, i.e., rapid insertion with slow withdrawal. After inserting the needle under the skin, thrust the needle directly to the required depth, and then manipulate the needle to promote the arrival of qi. Before taking the needle out, lift the needle 3 times to the 3 different levels, with manipulation at each level. When reinforcing, slow thrusting is used to gradually increase stimulation, while rapid lifting aims at reducing stimulation to assure effect and reinforcing the deficiency. This is done with mild stimulation. When reducing, rapid thrusting is used to increase stimulation, and slow lifting will further increase the degree of stimulation in order to reduce the excess. This is performed with heavy stimulation. Rotation. Rotation is performed by twisting the needle with the thumb and index fingers. The quantity of the stimulation can be determined by the rotational amplitude, frequency, and the difference of the unit. One complete turn is considered 1 time. The unit includes the time and the frequency. To reinforce, one uses a small amplitude and a slow frequency with mild stimulation. The angle is less than 180 degrees, and the frequency of manipulation is up to 5 times per 10 seconds. Reduction is achieved with a large amplitude, rapid frequency, and strong stimulation. The angle is larger than 180 degrees, and the frequency should be 10 times per 10 seconds. Number 3, lifting and thrusting. This method is to hold the needle with the thumb, index, and middle fingers to perform the vertical movement of lifting and thrusting. The motion is one lift up and thrust down is counted as 1 time. Here, reinforcing is achieved by shallow thrusting, slow frequency, and mild stimulation. Reducing is achieved by deep thrusting, fast frequency, and strong stimulation. The degree of stimulation of the lift and thrust method can be determined by the depth, frequency, and the difference in the unit. A unit includes the depth and frequency. Reinforcing is obtained by thrusting the needle into the skin less than 10 millimeters and lifting and thrusting the needle 5 times every 10 seconds with gentle stimulation. Reducing is obtained by inserting the needle over 10 millimeters and lifting and thrusting the needle 10 times every 10 seconds with strong stimulation. Number 4, retention. Retaining the needle in the point for several minutes, hours, or even days is often used when waiting for the arrival of qi. This can further strengthen the effect of reinforcing or reducing. Currently, clinics apply the embedding method with intradermal and thumbtack needles. This method is subdivided into 2 subcategories, namely retention with manipulation and retention without manipulation. The retention with manipulation method is used to reduce the excess by rotating, lifting, and thrusting the needle every 5 to 10 minutes many times. Strong stimulation is required to achieve this result. The needle can also be kept in the body for a long time, such as when using the retention without manipulation method. Neither rotating nor lifting or thrusting are done. This has the effect of reinforcing and mildly stimulating. Number 5, respiration. This method coordinates the patient's or practitioner's breath with the needle manipulation. Having the patient breathe while inserting or withdrawing the needle can alleviate pain, while the practitioner's breath can assure an even rhythm and frequency of the manipulation. Also, it can keep the mind concentrated on count and quantity of stimulation with more accuracy. During the insertion and withdrawal, the patient should cooperate with the practitioner by breathing in or out. Insertion of the needle with exhalation and withdrawal of the needle with inhalation is known as reinforcing method. Insertion of the needle with inhalation and withdrawal with exhalation is considered as reducing. The patient's respiration is coordinated with insertion and withdrawal. The practitioner's respiration is used to measure the frequency. 4 times per breath is known as a slow frequency and is mildly stimulating. Rapid frequency is 8 times per breath, which together with strong stimulation results in reducing effects. Number 6. Keeping the hole opened or closed. How to deal with the needle hole after withdrawal is the concern of this method. The reinforcing method is to press the hole with mild stimulation. This maintains the body's resistance and prevents vital qi and blood from leaking. At the same time, pressing the hole can reduce any local reaction. In the reducing method, the hole should be left open without applying pressure. This strong stimulation releases qi and blood, particularly pathogenic qi, and can prolong the local reaction. Number 7. 9 and 6 manipulations. In this method, the needle is rotated, lifted, and thrusted in multiples of 9 and 6. In ancient times, the number 9 pertains to the yang aspect. Manipulating 9 times is considered to have a reinforcing effect. The number 6 pertains to the yin aspect and is used in the reducing method. A reinforcing manipulation is performed by rotating, lifting, and thrusting the needle for 9 times, which is considered 1 unit. And reducing manipulation is done by rotating, lifting, and thrusting the needle for 6 times, which is considered 1 unit. Number 8, shaking. To shake the needle around while manipulating and withdrawing can strengthen and stimulate. The needle is shaken from side to side without rotation, lifting, or thrusting. A small amplitude and slow frequency with a mild stimulation is used for reinforcing. A large amplitude and fast frequency with strong stimulation is reducing. Number 9. Circling. Manipulating the tail of the needle obliquely for 360 degrees as though drawing a circle without rotation, lifting, or thrusting is called the circling method. It can be used to strengthen the stimulation and is suggested for patients whose sensation from rotation, lifting, and thrusting is decreased due to thick abdominal fat. Reinforcing is applied by a small amplitude of circling and a slow frequency with mild stimulation. Conversely, reducing is employed by a large amplitude and a rapid frequency with strong stimulation. Number 10. Meeting and following. This method directs the needle tip either along or against the course of the meridian. Directing the needle tip along the course of the meridian functions to promote the circulation of the meridian qi and is reinforcing. When the tip is directed against the meridian, it is weakening the flow of the meridian qi, and hence reducing. The comprehensive reinforcing and reducing methods. Now that the basic reinforcing and reduction methods have been already discussed, by combining several of the basic methods in a systematic way, we can get comprehensive reinforcing and reducing methods. Setting the mountain on fire. This method is composed of reinforcing and reducing by slow and rapid insertion and withdrawal, 9 and 6 manipulations, and respiration insertion methods. Indications: cold limbs, paralysis, B syndrome, yang deficiency, and so on. Manipulation. Insert the needle while the patient is exhaling. The needle is manipulated at all 3 levels of depth: shallow, middle, and deep. Upon withdrawal, remove the needle from the skin and press the hole closed after the needle is withdrawn. Number 2, penetrating heaven's coolness. Like the previous method, this is also composed through the combination of reinforcing and reducing, 9 and 6 manipulation, and respiration methods. Indications: phlegm syndrome, wind stroke, epilepsy, mental disorders. Manipulations: insert the needle while the patient is inhaling. Manipulate the needle at the 3 levels of depth: shallow, middle, and deep. Then, remove the needle from the skin with the hole kept open for a while. Number 3, yin hidden within yang. This method is derived from the combination of the reinforcing and reducing method, achieved by slow and rapid insertion and withdrawal, as well as the 9 and 6 manipulations. Indications: cold followed by heat syndrome, excess within deficiency syndrome. Manipulations: divide the needling depth into 2 parts, shallow and deep. First, insert the needle to the shallow depth and manipulate the needle according to the yang number. Then push the needle as far as the deep level and rotate the needle according to the yin number. Number 4, yang within yin. Again, the method is derived from reinforcing and reducing method, slow and rapid insertion and withdrawal, and the 9 and 6 manipulation. Manipulations: divide the depth of penetration into shallow and deep. Insert the needle into the deep first, rotate 6 times, and then lift to the shallow and rotate 9 times. Indications: heat followed by cold syndrome, deficiency mixed with excess syndrome. The 4 methods are mainly used for points which have abundant muscles, such as huantiao, fengshi, jianyu, and quqi. Shaoshan Huo and Po Tianliang divide the depth into the 3 parts of shallow, middle, and deep. The depth of insertion for the 2 methods, yin within yang and yang within yin, are divided into the 2 parts of shallow and deep. Number 5, blue dragon swings tail. Manipulations. After the arrival of qi, the needle tip is pointed towards the diseased area. Holding the needle, shake it to the left and right gently for 9 or 27 times. Indications: obstruction of meridians and B syndrome. Since the needling method is that of oblique subcutaneous insertion, this method is applied for those points that forbid perpendicular needling, such as Bai Hui and Danzhong. When reinforcing, hold the handle of the needle and shake it gently. When reducing the excess, increase the amplitude and frequency while shaking the needle. Number 6, white tiger shakes head. This method is composed of lifting, thrusting, rotating, and shaking simultaneously. Control of the frequency is in rhythm with the practitioner's respiration. Manipulation with small amplitude is for reinforcement, while manipulation with large amplitude is for reduction. Manipulations. The doctor keeps breathing evenly and inserts the needle to the required depth. When thrusting, the doctor rotates the needle counterclockwise at the rate of 1 exhalation per shaking of the needle. He then rotates the needle clockwise and keeps the rhythm of 1 inhalation with 1 shaking of the needle while lifting the needle at the same time. Number 7, green tortoise probes hole. Manipulations. Insert the needle perpendicularly to the certain part of the diseased area. Then withdraw the needle to the shallow level. Repeat at an angle by probing 2 times downward, and then followed by 3 times upward. Indications: pain and numbness of the local area. Number 8. Red phoenix flying in and out. Manipulations: divide the depth of the point into 3 levels: shallow, middle, and deep. Insert the needle to the deep level and then lift to the shallow. After the arrival of qi, thrust the needle into the middle level. Hold the needle handle and move around the point 360 degrees. Then twirl the needle and release the hold, causing a vibration that strengthens the needling sensation. Indications: B syndrome, muscular atrophy, paralysis, and so on. Number 9. The fight between the dragon and the tiger. This method is derived from the 9 and 6 manipulations. Manipulation: insert the needle to the required depth. Rotate the needle counterclockwise 9 times. Then clockwise 6 times. Repeat this procedure several times. This method is mainly used for those points that cannot be manipulated with lifting and thrusting method, such as 列缺, 内庭, and 大陵. Indications: atrophy and B syndrome. Number 10. Dragon and tiger ascending and descending. Manipulations: divide the depth of the point into 3 levels. First, insert the needle to the shallow level. Then, turn the needle around counterclockwise and thrust the needle to the middle level. Lift the needle to the shallow level again and turn clockwise 9 times. Next, thrust the needle downward to the deep level and turn the needle clockwise. Finally, lift the needle to the shallow level and then thrust to the deep, again turning the needle counterclockwise for 6 times. Indications: all obstruction syndromes of qi and blood. Number 11. Vigorous lifting and thrusting. This is a heavy reducing method using a large amplitude of rotation with vigorous lifting and thrusting. Manipulations. Insert the needle into the skin. After the arrival of qi, thrust quickly and lift gently. Then rotate counterclockwise 9 times. This is followed by swift lifting, gentle thrusting, and 6 clockwise rotations. Repeat this procedure several times. Indications: ascites and edema. Number 12. Hungry horse shaking bell. This is a gentle lifting and thrusting needling method for those patients who have poor tolerance and delicate constitutions. It has been developed from the even movement of Ling Shu. Manipulations. Hold the needle handle with the thumb and index fingers of the right hand. Thrust and lift the needle gently. Repeat this procedure several times. Indications: all deficiency syndromes.
"一路漫漫，披迹相伴，